Good afternoon. I'm David Summers. I'm the publisher of the Long Beach Post and the Long Beach Business Journal. Today we're continuing what's becoming a series of live 30-minute discussions with experts and industry leaders to gain perspective on the impacts locally, across the state, across the country, and the world about the coronavirus health crisis. Today our discussion is with Dr. Mario Molina, former CEO of Molina Healthcare. He has been a healthcare leader for decades. Earlier in his career, he was a medical researcher. He's run both a private insurer and a health group. He is part of United States of Care, a nationwide advocacy team. You are a leader in the field, and we wanted to get your perspective today about both the virology of coronavirus and COVID-19, but also the impacts on the healthcare system. So for anyone watching live online, please send your questions in. We're going to try and answer as many as we can. But the first question that I wanted to ask, and one of the things that I wanted to point out, is we are 6 feet apart. We have these marked on the table. We take precautions to follow the social distancing protocol. But I wonder what you've noticed about social distancing. What are you seeing that people are doing or not doing that's working or not working?
Well, that's a good point. And David asked me if I wanted to do this remotely or if I wanted to be here. And I wanted to be here because I wanted for us to demonstrate the proper way to hold a conference like this and do social distancing. You have undoubtedly seen some press conferences that haven't been done the right way, where people crowd around a podium. This is how it should be done. And when I am out in the community, I see people walking at a respectful distance. You see people in the grocery store, they're spacing themselves out. I think people are really getting it. And I noticed today when I was on my way down here, there are very, very few people out and about. So people are taking this very seriously.
What do people need to understand about the importance of social distancing? Why does this matter for this virus and this response?
So there are a couple things you need to know about the virus. The virus is a respiratory virus. In other words, it affects your respiratory system, and it's spread by coughing and sneezing. And I see people that wear masks, and the masks don't really protect you per se, because the virus is very small and it can go right through those paper masks. The most important thing is the social distancing, because if someone coughs or sneezes, the droplets are only going to go 2, 3, maybe 4 feet, and then they settle to the ground because they're large and they're heavy, and they settle on surfaces like desks or the ground or railings, and that's where the spread of the virus comes from, people touching things. So when I see people at the grocery store, for example, wearing a mask, I think it's kind of a waste of the resource. It's not really going to protect you in a grocery store. It's not going to protect you in a room like this. It's spread by touching surfaces. Where the masks are helpful are certain situations. Think about an OR. Doctors wear masks. Why? Not because they're afraid that something's going to leap out of that patient and infect them. It's not to protect the doctor. It's to protect the patient. So in a hospital setting where the staff is surrounded by lots of sick patients, there's virus everywhere and people are coughing and sneezing. They need those masks to protect themselves. When we had patients with active tuberculosis, we used to put the mask on the patient because if they coughed, the mask would trap all those droplets. That's the purpose. Social distancing is the best tool we have, short of a vaccine, to protect us during this epidemic.
Along those lines, you're talking about the importance of masks. One of the questions that we got in was, do homemade face masks work, or do they need to be placed over a disposable N95?
Well, unless you're working in a hospital or you're a paramedic or you're working in a clinical setting, you don't need an N95 mask because you're not around aerosolized particles. Aerosolized particles are really small, and they typically come from medical procedures. So if you're intubating somebody, if you're suctioning someone, you're getting these very fine droplets. But for the rest of us, it doesn't really matter because the virus doesn't travel very far. And you shouldn't be that close to anyone anyway. So I don't advocate that the public at large use N95 masks. I think if you want to wear a mask, the real value of a mask is it keeps you from touching your face. It reminds you, because that's how the virus is going to be spread. You're going to touch a surface, you're going to touch your face, you're going to rub your nose, and you're going to get the virus. So if you want to wear a mask for your own protection, that's really what it does. It reminds you not to touch your face. it doesn't really protect you from inhaling things. Even the surgical masks, the viruses go right through. Even the N95 mask. An N95 mask will filter out particles down to 3 microns. That's very small. But the virus itself is 1 micron, which means the virus can go through those N95 masks. Now, they do provide some protection, because you can just imagine, if you have 3 linebackers and they're trying to get through a door, if they line up and go in one at a time, they can go right through. But if all 3 of them are trying to get through at the same time, they can't do it. And that's kind of the purpose of the N95 mask. It will filter out some of the virus, but it's not perfect protection. So the best thing to do is stay away from people, keep your distance, wash your hands a lot.
One of the things that I've noticed is apparently I spend about 70% of my time touching my face. I've never been more aware of that. I wake up in the morning, and when I cough or clear my throat
Right.
or I randomly sneeze, the first thought that comes to my mind is, oh gosh, I've got it. At what point does having allergies to things in bloom or something else going on that's routine, when is it something more? When should the average person be concerned that they've been exposed? What does this look like to a typical person?
Well, coronavirus causes cough, fever, sneezing, body aches, and just sort of a general malaise and lack of energy. Not unlike a bad cold. And in fact, 5 to 10% of all colds are caused by coronaviruses. Not this particular coronavirus, but other coronaviruses. So you're going to feel like you have a bad cold. When you need to worry is when you have a fever or you're short of breath. Most people have mild infections, and what we know now is that 30 to 50% of patients who are infected with the coronavirus and test positive may not even know they have it. They may not have any symptoms. And so the problem there is that you can look at someone and they look normal to you, they feel fine, and they may be carrying the virus. Again, that's the importance of this separation and social distancing, because you don't know who has the virus or when. It could be almost anyone, anywhere. So that's why I would encourage you to stay away from people as much as you can. And if you feel sick, you don't necessarily need to go to the doctor. We're doing a lot of telemedicine. Call your doctor. Call one of these telemedicine services. That's the way to do it properly. Unless you need to be in the hospital, don't go to the emergency room. I mean, if you're feeling short of breath, you need to go. But if you show up with a bad cold, there's nothing they're going to do for you. There's no treatment for this. There's no antibiotic that's going to work. There are no antivirals. So the best thing to do is stay home, separate yourself from others, wash your hands.
Mario, there was some breaking news as we were coming into this about the update from the city that 8 Long Beach firefighters have tested positive for COVID-19. We were talking a little bit about the impact on first responders, on people who are still working in essential businesses like residents, people in Amazon warehouses. Can you talk a little bit about that? Are they catching it from infected people? How is this moving around in essential businesses and first responders?
Well, in about a third of all cases of the coronavirus right now, no known person or site is identified. We can't figure out where people get it. And this is going to be a common recurring theme. Somebody gets sick, and the first thing you want to know is where did they get it? It may not be possible to know. And I suspect that in the case of things like first responders or people working in hospitals, a lot of those infections are going to be acquired not at work, but outside of work. Let's suppose you were working 8 hours a day for Amazon and you get the virus. You probably didn't catch it at work. You probably caught it at home or on the way to and from home. That's the thing you need to remember. You can't assume that when someone that you work with tested positive, they got it at work. On the other hand, if you're working closely with someone who tests positive, you may want to quarantine yourself because you don't know if you've got it or not. The time from exposure to the onset of symptoms is on average about 5 days. By 14 days, 99% of people will get the infection if they're going to get it. So if you're affected, that's why the 14-day quarantine rule, it's a pretty good indicator that you are free of the disease. But basically, if you've been exposed, you can pretty much count on 4, 5, 6 days from the time of exposure until you start showing symptoms.
There's been a lot of information over the last few days about treatments, about various existing antiviral medications, about we've seen some things about other obscure treatments, things that I'd never heard of before. Are these untested treatments, are they dangerous? Do they work? What have you seen? What do people need to know about all the discussion of ways to treat this that are coming out right now?
Right now, we have no effective treatment. There was a study that was just published recently in the New England Journal of Medicine where they looked at 2 drugs, antiviral drugs used to treat HIV. They had no effect. That's disappointing. But at the same time, it's good news in a way because it allows us to move on. And we won't keep treating people with these antiviral drugs that aren't effective. There's been a lot of talk about chloroquine, hydroxychloroquine, and azithromycin, the Z-Pak. There's really no evidence right now that those work. The idea that they might work comes from studies done in test tubes. Basically, in the test tube, chloroquine, hydroxychloroquine can prevent the virus from binding to cells. And the way this virus works, it looks like a tennis ball with a bunch of golf tees sticking out. And it goes along and it attaches to a cell, it latches onto a receptor, and then the cell takes it inside. Once the virus is inside the cell, it takes over the cell's machinery and begins making copies of itself, and then they're released. So one thought was if we can prevent the binding, we can prevent the disease. But so far, there's no indication that that really works in humans, in the body itself. So people are concerned because these drugs do have some serious side effects. Chloroquine and hydroxychloroquine and the combination with azithromycin can cause heart problems. And they can interact with other medications. It can cause hypoglycemia. People really should not be taking these drugs to ward off the disease. There's no evidence that that will help. And right now, there's no evidence that it actually is useful in treating the disease. There's one small study from France. Problem with that study is they gave a bunch of patients the drug and they got better, but they had nothing to compare it to. They might have gotten better regardless. So we need controlled clinical trials, and we need to do these things properly. You know, we have benefited tremendously from science, and we can't abandon that discipline and that scientific research and go off and look for magical cures. This is not the right time to abandon science. I'm really encouraged because of the tremendous exchange of data, real time almost, from doctors around the country about what they're seeing, what they're doing, and what might work. But we have to be careful about all these treatments and herbal remedies. We don't have any effective treatment. It's separation that is the important thing.
I want to spend a few minutes talking about the healthcare industry, about where we're headed. But first, we've gotten quite a few good questions in about the health implications of the virus. Things like, does warm weather slow the spread? If I have asthma, does that put me at higher risk for complications? It seems like people are still trying to get a sense of the impacts. Do food and package deliveries risk spreading the virus? Should I remove my clothes when I get home? Help us understand how people need to behave and what it might mean for seasonal allergies, or it's something different, or if I've got an underlying condition like asthma.
You know, those are great questions, and we don't have good answers for all of them. We do know that people with certain pre-existing conditions like hypertension and diabetes tend to do worse. Older people tend to do worse. So the break point seems to be at about 60 years of age. The mortality rate is probably 1% to 2% for people under age 60. At age 60, it goes up to about 4%. At age 70, it goes to about 8%. People, you know, above that, it's somewhere in the teens, maybe 15 to 20%. So if you're 80 years old and you get this, you've got a 1 in 5 chance of dying from the coronavirus. That's why we need to be really careful about older people, helping seniors. We don't want them going out. We want them to stay home. Someone can do their shopping for them. The other question is about bringing stuff home. there's always a danger you're going to bring it into the house. The best thing you can do is wash your hands, because that's the major source. It lasts for different lengths of time on different surfaces. So, clothing, cardboard, a few hours probably. Metallic surfaces, copper is good, but who has copper, countertops, right? It's not a common thing, but there's some properties in copper that seem to kill the virus quickly. It can live for a day or two on stainless steel. It can live for up to 9 days on plastic. So one of the things I've been telling people is, I see all these people going out and buying plastic water bottles. I don't think that's a good idea. Use a glass, use a mug, wash it, hot water. Soap. So that's another important point. The coronavirus is what's called an enveloped virus. It has a protective envelope around it. But that envelope is broken down by soap. So soap and water breaks open the virus and kills it. Hand sanitizers depend on alcohol, and alcohol is not as good as soap and water. And what happens is people use these hand sanitizers and they think they're safe, and they're really not. I'd much rather see people use just plain old soap and water. It doesn't need to be antibacterial soap, just plain old soap and water. The virus can be killed by heating. So if you cook food and you need to cook it to about 160 degrees Fahrenheit, that will kill the virus. The water supply is safe. You can drink tap water. There's no need to be buying and hoarding bottled water. And I really think you're better off, again, using a mug or a glass that you can wash after you use it.
That's great information. Thank you. I want to talk a little bit about our cultural reaction to this. Are people overreacting? Are people underreacting? Are we doing enough? Are we doing not enough? We're seeing different levels of responsiveness from New York versus other parts of the country or here. Our mayor has been very proactive in saying we need to do more. We need to do more. We're not doing enough. And the sooner that we do, that we take the significant steps, the sooner we'll get back to normal. Are we overreacting or underreacting?
Well, we're certainly not overreacting, I can tell you that. I think that all the steps that have been taken by Mayor Garcia, by Governor Newsom, by the health department have been appropriate. I mean, everything has been appropriate. This has been well done. If you want to look at the prototype of how to handle a viral epidemic, California is the shining example of what should be done. We see different responses from different states and different leaders. I think people that live in states that have less dense populations probably don't feel it the way we do here because there are fewer people. But there's a real danger in that because we have a high concentration of hospitals in our urban areas. If you're living in a rural area, you may not have great access to a hospital or to an ICU. And so you may get this false sense of security because you're not seeing people who are sick. And when it hits, you're going to be in real trouble. A lot of people believed, at least initially, that this was a hoax or an overreaction. Well, the truth is, it wasn't. But when it becomes personal, people begin to really pay attention. And I think people are going to start seeing friends, family members who get this, and they're going to go, oh, I guess this is real. So, for example, just before we came in here, I got a text message from a friend who told me that one of our mutual friends has come down with coronavirus. And I know someone who told me the other day that they had a friend who died from coronavirus. When it starts to happen like that, it becomes real, it becomes personal. Before that, it's abstract, and you don't believe it. It's hard to believe. I mean, the world doesn't look different other than everybody's at home. So how can there be this epidemic? But it's growing by leaps and bounds. In 2 months, we've gone from the first case in Washington to yesterday, 50,000 cases. And remember, this is a gross underestimate because we don't have the testing supplies. If we were testing people, I think we would see 5 to 10 times that number of people are infected.
To that end, a great question a viewer just sent in was, how are people recovering if there's no effective treatment? How does the human body, how does our physiology get over this if there's no pill to take at this point?
Well, remember that most infections cure themselves. The body has this immune response, and the purpose of antibiotics is just to augment or help that. If you take someone who's immunocompromised, antibiotics don't work very well. They are an adjunct. Your primary way of responding to any kind of infection is your immune system. So, I mean, this is a good time of year to make sure that you're getting plenty of rest, eating properly, and getting some exercise. You want to take care of yourself, and sleep is a big part of that. Your body will heal itself, and if you get infected, the vast majority of people will recover, and when they do, their body develops antibodies that we think will prevent them from getting reinfected. But remember, this is a novel virus. That means we've never seen it before. So no one has immunity right now. And even though you may have gotten a cold from a coronavirus, it's a different strain. And for the coronaviruses, the immunity seems to be very strain specific. For influenza, it's not. So if you get an immunization or you've had the flu in the past, it confers some immunity. But for this, there is no immunity.
I want to talk about the healthcare system. You were a long-time executive in the healthcare industry, working with lawmakers. One of the things we've heard from a lot of leaders is that the social safety net and the healthcare industry need to and will look very differently on the other side of this. What about our current healthcare infrastructure works and doesn't work compared to other industrialized advanced nations? And through your connection to United States of Care, what do you think the healthcare system needs to look like on the other side of this to be prepared for the future?
Well, I think it's a double-edged sword. Our strengths and our weaknesses are sort of the same thing. We are a very entrepreneurial people, and so that's good when we're trying to look for new cures and new treatments, but it can also be a detriment because we tend not to trust authority, and we tend not to believe that when someone comes to us and says the sky is falling, we tend not to believe it. The other thing is, because we prize our freedom so much and our independence, we don't respond to authoritarianism. So we have 50 states. Each one is acting a little bit differently. And, you know, if you go to a place like China, when they say everyone stays home, everyone stays home. And if they need to, they'll bring out the army to enforce that. We're not going to do that here. We don't want to bring out the army and have guys with guns standing on the corners to make sure that you don't leave your house. But quarantining is very effective, and we've seen that it works because in China, we've seen the cases peak and come down. And that's what gives me hope. We know that we can recover from this, but we're going to have to quarantine ourselves. We're going to have to rely on social distancing. And I think that it's the 50 states all doing things 50 different ways that makes things difficult. And if we get a state, let's just pick some Midwestern state that doesn't follow through, like we're doing in California, and then somebody from that state comes to visit us, they can reintroduce the virus. And in fact, in China, many of the new cases they're seeing are actually being imported from somewhere else because they've stopped the spread within the country.
Just a few questions left in the time that we've got. One of the themes for the calls that I've been getting lately from business leaders, community leaders is, when are we going to be back to normal? And we've got national leaders saying in 2 weeks, things are going to start restarting. You'll see a sense of normalcy by Easter. What are things going to look like 2 weeks from now? What are they going to look like 2 months from now? When will we start to see some sense of normalcy again?
It's difficult to know, but I think the best answer we can give at this point is that we can reopen businesses and we can go back to business as usual when it's safe and not before. My father had a saying when he had a difficult patient. He would say, the success in your case depends on which one of us is going to be the doctor. And in this situation, I think the nation's safety and health depends on who's going to be the doctor. And right now, my money is on Dr. Fauci and not on Mr. Trump. We can't reopen things in 2 weeks just because it's expedient or someone's getting pressure from Wall Street or they're worried about the economy. If we open businesses up too soon, things will actually get worse because we'll have relapses, and this epidemic will just go on even longer. So we really need to knuckle down, be prepared to stay home, tough it out for a few weeks, and see how it goes. We know from China that this is the best way to go and that we can recover. But it may take several months, and we're just going to have to be prepared for that. And that means we're all going to have to work together to support each other. We're going to have to donate to charities that help people who have lost their jobs, because people will lose their jobs during this period of time. And we're going to have to help each other out. Families are going to have to help support each other. You may have to send money to your kids. All these kinds of things. You may have to help your friends. That's what we need to do. We need to come together as a community as if this were a war. Think about the Second World War. Everybody pitched in some way or another. Some went off to fight the war. Those are the doctors and nurses. Some stayed home and did production work. Those are the people making masks and ventilators. And some people had to just stay home and tend the farm. But we all have a role in this, and we're going to have to work together to get through it.
The last two questions that I wanted to ask are, you obviously, clearly have done a significant amount of reading and research into this. What are the informed voices who are the informed voices? What are the informed sources that you trust, that you're reading? Who would you encourage people to read what they're saying about this and learn from?
Well, I think the best general...
Besides the Long Beach Post.
Yeah, of course. The best general source for information on all this, I think, is Anthony Fauci. Remember that he went through this with the AIDS epidemic back in the 80s and 90s, and he was vilified. People hated him, but he told people the truth even when it was uncomfortable. And he's doing that now. I think he is our best national spokesperson on what we should be doing. Schools of public health are coming out with information. I read the New England Journal of Medicine, I read the Annals of Internal Medicine, I'm reading medical journals. But all this stuff is coming out, and you'll get this information on the news too, because it's being shared. One of the best sources we have right now are reports from China. And soon we'll be getting reports from the state of Washington, where the virus first really struck. That experience is invaluable, and that's what we're going to have to rely on. Real experience, not fad diets, gimmicks. Somebody heard something that might be helpful. We need real science, and we need to rely on the experts.
I also just want to give a shout out to our local health department here in Long Beach as an informed source. We have the benefit in Long Beach of having our own city health department that has been very good, from my perspective, of getting information out and having that as a resource in addition to California Public Health and the county's health department.
Yeah, the county's website too is another good source of information.
The last question that I wanted to ask is, what is the new normal? What do you think will forever look different on the other side of this? What do you hope will forever look different on the other side of this?
There's a very good chance that about half the population is going to contract this virus before this epidemic is over. That means there are going to be a number of people on the other side of this who have immunity. I don't think this virus is going to go away completely. Much like the flu, we may have a coronavirus season that kind of superimposes itself on top of the flu. The fact that a lot of people will become immune to it will help prevent spread in the future. The most important thing we need is a vaccine. To really control something like this, a disease that is highly contagious and makes people fairly sick, you really need a vaccine. So our best instrument for attacking this right now is social distancing. Stay home, stay away from other people, wash your hands, and until we can get a vaccine, this is what we're going to have to do. I think that in a few months, we will see a big drop-off in the cases. Life will come back pretty much to normal, and hopefully by this time next year, we will have a vaccine, and maybe by this time next year, we'll know what kinds of medications are helpful. They may not exist right now. We may have to invent them. But I'm hopeful that we can be better prepared next year for this than we were this time.
Dr. Mario Molina, thank you for coming in and joining us today. That was a fascinating conversation. You can follow Dr. Molina on Twitter. Your Twitter account is outstanding in terms of the information that you're posting, sharing what you're reading about, very informed. So look for him on Twitter and his other social media accounts. Before we wrap up today, I just want to remind our readers and our viewers that the Post is continuing these live conversations at 1 p.m. Right now, as scheduled, these are all subject to change, but the upcoming schedule tomorrow at 1 p.m., our high-low editor, our arts and culture editor, Steve Lowry, is going to be having a conversation with Martin Hasselbach, the musical director for Musica Angelica, our Baroque music group, live from Austria, about the perspective of the impact on the global music industry. On Friday, tentatively scheduled, managing editor Melissa Evans will be speaking with Marcel Epley, the president and CEO of the Community Foundation, Long Beach Community Foundation, about the city's relief fund and other ways that the public and foundations can help. Stephanie Rivera, one of our reporters, will be hosting a Spanish language discussion with school board member Juan Benitez next Tuesday. And then we also have Melissa Evans, managing editor, again next Thursday, the 2nd. We'll be talking with Luann Bynum, the newly appointed interim superintendent, president of City College. More to come. We welcome your questions in advance, and both during advance and during the live event. If you have any ideas of guests that you'd like us to invite in to do these conversations, please send us your ideas. You can suggest guests to Melissa Evans at melissa@lbpost.com or send notes to us on our social media page. Again, Dr. Mario Molina, thank you very much. Be safe out there, and thank you for joining us today. Have a good afternoon.